All right. Just doing a couple last little checks here. Mic's good. Check, check. All right. Everything's looking good. Streaming's going. Just give it a couple more minutes. Let some folks get in here. While we're waiting, welcome. I'm Brandon Gonzalez. Been doing weekly lives every Monday at 11:30. Just going over some quick Medicare tips. But today, we're going to be going into a lot more depth, a lot of extra things that aren't really in the Monday lives. Just gonna get into everything, any and everything Medicare. So again, just letting a couple more people get in here. We'll get started here in just a couple seconds. All right. So, as I was mentioning earlier, Brandon Gonzalez, we're just gonna dive all into Medicare today with our Medicare Made Simple presentation. You'll have the slides here behind me. We're just gonna kind of go through this, talk through some stuff, some key dates, probably the parts to Medicare, some key dates, some important financial information, just any and everything Medicare. So getting started here. Let's see. All right. So again, I could have swapped over, I guess, but today, we're just going to go over the fundamentals of Medicare, Medicare supplement plans, Medicare Advantage options, some prescription drug coverage, and then some key dates and additional info. So moving on, here's the scary stat, right? Retirees face worrisome healthcare expenses. Now, these numbers were pulled from a couple of credible sources, but really all they mean to the everyday person is that as you get older, you're probably going to end up spending way more in healthcare costs than you have in the past. Outside of a couple of, some accidents maybe in your younger years, but for the most part, consistently, people who are over the age of 65 are seeing more doctors. They're going to more facilities. They're seeing specialists. And this slide just illustrates that. It shows you a number here, $6.2 trillion. And trillion is something that not a lot of people, probably not even myself, understand. But that is the estimated annual United States healthcare spending in or by 2028. It's a big number. So it's a 5.4% growth going over those years from 2019 to 2028. It's just here to illustrate that, to have in your mind that when you're retiring, when you're getting older, you're probably going to spend more money than you ever have towards healthcare costs, right? And that's a big key, or that's a big problem, big red flag for someone going into retirement. Why is that? Why is it a problem that I'm going to be spending more? Well, the simple answer is because in retirement, you probably aren't going to be making as much as you did when you worked full time, right? So your money's going to be kind of cut because you're retiring, you're not working full time anymore. You got Social Security and maybe some other investments that you might have. But for the most part, people around are living off of Social Security. I talked to a gentleman today. All they have is their Social Security, and it doesn't add up to that much, right? So when you start factoring in extra expenses, especially if you don't select a plan that's going to perform well for you, or if you don't select a plan at all and just keep A and B, those expenses are going to be insurmountable, right? They're going to be very, very detrimental to your finances just because you're not making as much and you're having to spend more on healthcare on average. So just some statistics for you there. All right, here's another illustration here of just how health insurance premiums have, gone above and beyond of just simple inflation. Not going to spend too much time on that. You guys know that everything's expensive and it's only getting more expensive, right? Another illustration here, just saying what I had already said, just we'll show it to you 3 times and maybe you'll catch one of those images and it might catch your eye. But senior citizens are having to spend more of their budget, which their budget might not be, their budget's probably half of what it was when they were working full time. So just keep that in mind. So we have this slide here. These are some of the changes that happened from 2025 to 2026. We have this here to kind of illustrate for people that may not have started Medicare yet this year. Maybe they're Medicare eligible this year, and it's the first time they're going to be on it. So they want to know what's new in 2026, right? But for my people that have already been on Medicare, y'all have already seen this. Y'all seen this last year in October, probably a little before that, actually. So let me explain. So every year, things in Medicare change, right? Or they have the opportunity to change. In this year, or from 2025 to 2026, the prescription drug costs. So they raised the out-of-pocket cap to $2,100, and then the deductible to $615. Drug price negotiations, negotiated prices on 10 high-cost Part D drugs estimate $1.5 billion in savings for over 9 million beneficiaries. They made a change to the GLP-1 weight loss drugs, mental health, and then caregiver support as well. So if you guys want to know the changes as soon as possible for 2027, definitely stay up to date with us. We'll be updating everyone on those and making sure that we handle them accordingly. All right. So, I've been talking for a little while about this thing called Medicare. So let me dive into and explain what Medicare actually is, right? So Medicare is a health insurance program offered by the government, probably the largest. Okay, it says it there. It is the largest, but it's run by CMS, Centers for Medicare and Medicaid Services. And it's just a health insurance program that's offered to people who are of age, who are, I want to say who are 65 and above. However, you can get Medicare before 65. That's disability Medicare. If you're on disability for 24 months, you are Medicare eligible. We'll get into all that as well. But Medicare in itself is divided into a couple of parts. This says 3. Some people call it 4. But the parts to Medicare are A, B, C, and D. Okay, you might be asking yourself, well, I've heard about Part E and Part G and F and all that. Those are plans. That's not the parts of Medicare. And I'll explain that different terminology a little later when I'm talking about Medigap or Medicare supplements. So, but for this part, we got the 4 parts of Medicare, your 4 pillars here. You got A and B, C, and D. And I'm going to dive into those. So Medicare Part A. All right, this is just let's talk about A and B together. I'm going to do them individually, but these two can go together, probably do go together more often than not. So A and B is that little red, white, and blue card that you get, okay? It's got your Medicare number on there, and it's got some effective dates for your Part A and your Part B once they start. But how it goes on the front end, okay? You get this card in the mail from Medicare telling you that you have now qualified or you're entitled to Part A, all right? And you get that by working and paying 40 quarters of taxes, all right? So you pay for Part A pretty much your whole life up until the age of 65 as you're working and paying taxes and things like that, right? So they'll give you Part A. And it's not free because you already paid for it. So Part A is just your hospital insurance, quite literally just your room in those scenarios. So inpatient hospital stays, skilled nursing, hospice care, home health services is just your room, okay? So you'll get that card in the mail. They'll say, hey, here you go. Congratulations. You qualify for Part A. Now, on that letter, they will ask you if you want to opt into or enroll in Part B, all right? Now, you got Part A. You didn't have to pay for Part A, at least right then when you got it, but you paid for it over time by working and paying taxes. Part B, to have Part B, you have to pay for it, right? And in most circumstances, I guess people that have Medicaid, they don't pay for their Part B, but for the normal everyday consumer, you got to pay for Part B. All right. It was $185 last year, so it had a premium on it. This is monthly. It was $185 in 2025, and now they have upped it to 202 and some change. We just call it 203 around here, so $203. If you've started Social Security, they will deduct that 203 out of your Social Security check. If you have not, then you can pay for it out of a bank account. But either way, you have to pay for Part B, unless you got Medicaid. But for this illustration, you got to pay for Part B. And Part B is going to be your medical insurance, right? So you got Part A is your hospital room, and now Part B is what they're going to do to you, right? Doctor's appointments, outpatient care, any kind of occupational or physical therapies, preventative services, any kind of administrative care is going to be under medical, okay? And your Part B is gonna help cover that for you. So let me pause here. So you got Part A and you've enrolled in Part B, and you have A and B together, okay? Um, that's not, that's not Medicare. Well, it is Medicare, but that's not how it's designed to be, right? Part A and Part B are just supposed to be a stepping stone for you to get a Medigap or a Medicare Advantage plan if, one of those is necessary. And I'm sure that I'll talk about this later on in the video, but I'll touch on it a little bit now. Part A and Part B only, just having that, right? That gives you 80/20 coinsurance, but there's no limit or there's no cap to what you can pay or like how much, how many times they can charge you that 20%. So you quite literally don't have a max out of pocket. You don't have a ceiling. You got 80/20 coinsurance, which is kind of probably what you've been used to your entire life. And now that you have the option to take that away, right, to get better insurance, I think you should take it. So just having A and B is not what Medicare has to offer you. All right. That's just a stepping stone. And I say that because you have to have A and B to get anything else that Medicare has to offer. Okay. So again, I'll touch on that a little later, but we're just going over the 4 parts right now. So I went over Part A, is your hospital insurance. Part B is going to be your medical stuff. All right. So moving on, if I remember the alphabet correctly, C is probably next. So here's Part C. That's going to be Medicare Advantage. Okay. That is Medicare Part C. And remember, I said you had to have A and B to get C and D. Okay. You got to have A and B to get anything else that Medicare has to offer. Okay. So Part C, Medicare Advantage. This is just, it's offered by a private company. You get it, and kind of coincides with your A and B to a certain degree. It's going to help take care of your $1,600 Part A deductible. It's going to help take care of your $287, I believe, this year, Medicare Part B deductible. And it's going to take away that 80/20 coinsurance, right? It's going to kind of cover that. So it's going to offer everything that Parts A and B cover. It often includes dental, vision, and hearing at no extra cost. They have wellness programs, and you can get it to include your Part D drug coverage if you need it as well. So Medicare Advantage, it's a big $0, typically $0 a month present, okay? That saves you from the unlimited 20%, right? It takes away the 80/20, saves you from a $1,600 Part A deductible, and it saves you from a $287 Part B deductible, all right? And it already includes at no extra cost. So for $0, you can quite literally get medical, dental, vision, and hearing, and prescription drug coverage. All right, moving on. Part D is prescription drug coverage. So, this is how you get your medicines and stuff. You can get this as a standalone, or it can be included in your Part C. If you got it as a standalone, that would mean that you probably had a Medicare supplement, or you were just really stubborn and you just had A and B only. All right. But if you don't get it standalone, you can get it put into your Part C if you decide to take a Medicare Advantage plan. So that's how you get your medicines and stuff. And that's the 4 parts to Medicare. All right. So I mentioned earlier, hang on. All right. Nose is kind of stopped up. All right. So we went over the 4 parts to Medicare. Now, who is eligible for Medicare? How do you get Medicare, right? So typically, people that are looking at Medicare are going to be aging 65 plus. So you're turning 65. That's when the normal everyday individual is eligible for Medicare. But you can get it through your spouse. You still must meet age or disability requirements. Disability that I touched on earlier. This is if you're under 65 and you are on disability for 24 months, you can qualify. Or any age that has end-stage renal disease or ALS, they can qualify for Medicare at any age. All right. Moving on. Automatic enrollment, Part A and Part B, who is auto-enrolled. Okay. So this is just illustrating who is auto-enrolled in A and B. This is just saying that if you take Social Security early, let's just say at 62, like if you've already started Social Security before you're 65, you could be auto-enrolled. And if you're not receiving Social Security yet, you have to enroll yourself. Automatic enrollment will not apply to you. So if you're 65 and you haven't turned on Social Security yet, you are going to have to enroll in A and B yourself. Okay. But this is typically what happens. You'll receive an initial enrollment period package in the mail. They mail it to you 3 months before you turn 65, and it includes your Medicare card. This is if you are auto-enrolled. This is only if you are receiving Social Security benefits. Okay. So hang on, let me back up just a second because it's going to segue into this slide. So this right here, this says you receive an initial enrollment period package by mail. You might be asking yourself, what is initial enrollment period? And common sense would probably tell you it's the first time that you're enrolling in Medicare, right? But some people need it spelled out for them, so which is completely okay. Well, we enjoy doing that. So Medicare initial enrollment period, we call it IEP, okay? This is a 7-month window, 3 months before you turn 65. So 3 months before your 65th birth month, the month you turn 65, and then 3 months after your 65th birth month. Okay. That's going to be your IEP. That's very important because your IEP is going to grant you a guaranteed issue window. That means you can probably get something that you might not qualify for because you don't have to answer health questions. And I'll touch on that in enrollment periods a little later. But if you retire after 65, your enrollment depends on when your employer sponsor coverage ends. That just means that some people don't take Medicare right when they're 65. Well, not the full thing because they're still working, right? And maybe you're that person and maybe your work benefits are just, provided to you at no cost and you don't see a reason as to why you should pay $203 potentially for Part B when your work benefits are free. So some people keep their work benefits for a little while until they fully retire from their job. Now, when you retire from your job, you're going to have another window of guaranteed issue. So if you don't take it during IEP and you still work, you can still have that guaranteed issue window after you've come off of your employer coverage. Okay, you get 63 days to do that once you come off of your work or employer coverage. If newly qualified due to a disability, your IEP starts at the time of qualification. So let me explain. Let's just say someone is in their 50s and they've been on disability for 24 months and they are eligible for Medicare. They want to take Medicare. Well, at the time when they get their Part A and Part B from disability, they're going to have, that's going to be their initial enrollment. So the very first time that they're doing Medicare. So they'll be able to have that IEP window as well. And then they would have another IEP window when they're 65. It's called IEP 2. All right. So you can potentially have two IEPs, but that's only for people that get Medicare by disability before the age of 65. Um, Missing your IEP without qualifying coverage may result in a permanent late enrollment penalty. All right. So that just means that, you have a window of when you can sign up for Medicare, right? It's that 3 months before, the month of, and 3 months after. If you miss that 7 month window and you don't have qualifying coverage, meaning that you don't have health coverage at all, or you don't have it through your work, or you know, if you don't have any coverage at all and you miss that window, then you will have a permanent late enrollment penalty that we'll talk about here in just a little bit. But those are irrevocable, so let's not do that. All right, moving on. All right, original Medicare costs. Let's see, probably what I touched on. Okay, yeah. So this is what I touched on earlier, and this is why I said what I said about people being stubborn and thinking that just having that red, white, and blue card with just A and B is enough. It is not enough. That makes you eligible for, um, makes you eligible to pay the unlimited 20%, your Part A deductible, Part B costs, all that. So this is just an illustration of Part A costs and Part B costs in 2026. So you'll see a $0 cost for Part A. That just means you've qualified for it because you've worked and paid 40 quarters of taxes. So you don't have a premium for Part A when you're 65, when you get Medicare, because you've already paid for it. Okay. Part A deductible, $1,736. That goes, that's per benefit period. And those benefit periods are going to be those hospital days. So as you can see, days 1 through 60, you'll have a $0 copay if you just had A and B. So you have a $0 copay, but if you get out on, day whatever and go back in on day whatever, you'll end up having to pay $434 a day because you've ran out of those days. And then days 91 through 50, that cost goes from $434 to $868 a day. So, and then if you stay for over 150 days, cumulatively, you pay 100%. Skilled nursing kind of works that way as well. Basically, what this illustration is saying, um, find you a plan, either a Medicare supplement or a Medicare Advantage, that doesn't leave you subject to all these big numbers that you see in this screen. Okay. Part B is going to be the same way. You see that 202.90 there. That is a premium. So if you have Part B, you do have to pay for that each month. Okay. That's not free. Part B is not free. So you got to pay for that. They will take it out of your Social Security check, or you can pay it from an account. But to have Part B, you must pay that 202.90. Unless you're an outlier and you have Medicaid, but for the most part, people are going to be paying 202.90. Part B deductible, I think it's 287. This illustration shows 283. Close enough, $4, not gonna make a difference. And then this is saying the 80/20 stuff, the 80/20 coinsurance, but there's no, there's no cap on that 20%. And that's what this thing says under it. So after the deductible, Medicare covers 80% of the approved cost. The remaining 20% has no annual cap. This is the gap that a Medicare supplement is designed to, fulfill. This is a little chart. This has to do with IRMA. It's an acronym. It just stands for Income Related Monthly Adjustment Amount. And this is just showing, this is important to us more so. It's important to the consumer as well, but this is just saying that if you're an individual, let's say you're not married, and you make less than $109,000 a year, all right, which is going to be a large majority of the people. So if you're making less than 109,000 as an individual, not married, on taxes, then your premium for Part B that you pay is probably going to be that 202.90 or 203 that I keep saying. But this chart just illustrates that if you make more than those numbers, you will have to pay more. You'll have to pay more for your Part B premium. And that goes if you're married, filing jointly too. You can see the chart there. I'm not going to read out all those numbers, but that just means that if you make more than a certain amount, you will pay more for your Part B premium. All right. Moving on. Okay, so if you come in office and we explain some things, then we're going to tell you which this we're just going to illustrate it this way. Okay, there are two routes to Medicare. Okay, path number one, we call it traditional Medicare. Path number two, it's Medicare Advantage. Right, those are the two ways that you can get your full Medicare coverage, not just A and B, because remember, we want to get away from that unlimited 20%. We want to get away from that Part A deductible and all those hospital days and those numbers. So path number one, traditional Medicare, you have your A and B, right? You get a Medicare supplement to fill in all those gaps that we mentioned, and then you have to buy a separate Part D or drug plan to go along with that because it's not included in your Medicare supplement. Path number two, you got Medicare Advantage route, which is Part C. It includes your A and B. It's going to include some extra benefits like dental, vision, and hearing, typically, and then it can include Part D or drug plans. You can get Medicare Advantage plans without drug coverage built into them. That's typically for people that are veterans, people that have VA benefits for their medicines, so they wouldn't need a prescription drug plan. And by the way, VA benefits that counts as credible coverage. So if you didn't take Part D, as in drugs, they wouldn't charge you a penalty for that because you had credible coverage. But that's only for my veterans that have VA benefits or some type of credible coverage, right? But you have to have Part A and B to get anything else, right? You got to have A and B to get a med sup. You got to have A and B to get Medicare Advantage, and you got to have A and B to get a drug plan as well. So you got to opt into that Part B. I know y'all might not want to come off of that $203 a month, but you got to. So here are some Medicare supplement plans. We'll talk about some of those. Medicare supplements, or Medigap, as it's sometimes called. Those, it's not like original Medicare. It's not gonna leave you. This takes the place of your 80/20 coinsurance and all of that stuff. Quite literally with Medicare supplements. Let's say you have a plan N or a plan G. Those people are, the only expense that they have to worry about is that annual deductible, and I believe it's $287. This is illustrated as $283, but I believe it's $287. I could be wrong, but again, $4 is not going to make a difference. So you got a med sup. It's gonna take away the coinsurance. It's gonna take away copays, out of pockets, all that stuff. So people that have Medicare supplements, they go and have some major stuff done medically. All they have to worry about is that Part B deductible, that $287 deductible, and after that, they don't pay anything else unless you get a plan in, and that's just one copay of I believe $20 on an office visit, and then $50 on an ER visit. So a Medicare supplement is funded by individual policies offered through private insurance companies. Insurance companies are required to offer the same basic benefits for each lettered plan, though they may charge different premiums. This just means that. So I'll tell you a story. I had a guy that came in today. He was dead set on having a Humana med sup, which is fine, great. I want to get him what he wants, but Medicare supplements, those plans. It says here insurance companies are required to offer the same basic benefits for each lettered plan. That just means that if that guy got a plan G from Humana, that plan G is going to be the same plan G no matter what company he chooses to get it through, right? So price point becomes the only variable, right? So, we were able to look, and obviously Bankers Fidelity is a fantastic company. So we were able to look, and Bankers Fidelity came in at the same plan G for like $50 less. So it doesn't make any sense it doesn't make sense for someone to get a certain name brand med sup, right? They all do the same thing. Price point is the only difference. All right, this is just an illustration showing how Medicare supplement covers the original Medicare costs. So let's just say that you know, A and B were going to be someone's primary, and then your supplement was going to be your secondary, which picks up everything that your primary doesn't cover. This is what this illustration is showing. So with a Plan G, a Medigap or a Medicare supplement, it's going to cover absolutely everything besides your Part B deductible. Okay, so Medicare or Plan G covers everything after the Part B deductible. It's one of the most popular plans just because it does cover everything. People can literally pay $0 for anything after they meet that $283 deductible. Okay, so they're really, really substantial. Here are some different plans. If you come in office and you see the sheet that I have, I'm gonna have Plan A crossed off. I'm gonna have Plan B crossed off. Plan D crossed off. This has got a star beside it. No, okay. I was thinking they might have some high deductible stuff in here, but we would look at a Plan G. Okay, so I would circle this one, cross K out, cross L out, cross M out. We're probably just looking at plans G and N. Now, F is a plan that is also offered in some instances, but you have to be Medicare eligible before 2020. Okay, and that's the only way that you can have a Plan F. But as you can see here, a Plan G is the most popular because all these check marks, right? It covers absolutely everything besides a Part B deductible. Okay, no copays, no out of pockets, no tricks, no funny business. And then Plan N is a little bit cheaper than Plan G statistically, so it's going to cover almost everything that a Plan G covers. As you notice, both of them don't cover the Part B deductible, which is at 283. And then now, one thing that Plan G covers that Plan N does not cover is Part B excess charges. Those, in my experience, are pretty rare. I think I've only seen someone with one of those, and it was like $8. So not really anything to be super concerned about. But these are the different MedSup plans. All right. Here are some more of the enrollment periods just tied to Medicare supplements. All right. So Medicare supplements have enrollment periods. Medicare Advantage plans have enrollment periods. These are the Medicare supplement enrollment periods. Okay. So you have open enrollment, which starts the month your Medicare Part B begins, and it lasts for 6 months. And right here it says you are guaranteed issue regardless of health status. This is your best window to enroll in a Medicare supplement. So what this means is guaranteed issue. So people that are over 65 and they've already taken Medicare, let's just say that they got a Medicare Advantage plan when they first started, that they're outside of their IEP window. They got a Medicare Advantage plan that anyone under the sun can get pretty much. And they don't like it because they have a lot of out-of-pocket costs, and you can't really budget for it. It says $0 on the front end, but now I got all these copays and out-of-pockets and this, that, and the other. So let's just say that person wanted to swap over to a Medicare supplement. Well, since they use their guaranteed issue window on something that everyone can get, now they're going to have to answer health questions, and they're going to have to medically qualify to get a Medicare supplement, which they might not be able to do that, right? Something might have happened in that time, or, they had an issue before that didn't have to be disclosed, but now it has to be disclosed. And they're just not able to get a Medicare supplement. And certainly if they do, not one that they would like to, or not one that they could afford, because you're not going to go preferred, you're going to go standard, right? And you're going to pay, way more. So this is your best window to get the best possible thing that Medicare offers, right? A Medicare supplement. That means that all you have to pay for, obviously, is your monthly premium for your Medicare supplement. And then after that, just cover that deductible of $283 for annually. I mean, that's you're able to budget for a Medicare supplement. You're not able to budget for Medicare Advantage. All right. So open enrollment period, that's your biggest one because you're guaranteed issue and you do not have to answer health questions. You do not have to medically qualify. The next enrollment period for Medicare supplements are special enrollment periods. These are triggered by qualifying life events. Like, let's say you lost your employer coverage or you moved to a different service area. You would also have a guaranteed issue, right? But not all plans are guaranteed issue under a special enrollment. So just keep that in mind. OEP, outside enrollment period, you must fully pass medical underwriting. and insurers can charge you more or deny coverage based on your health history. So you're not guaranteed issue outside of that period. So it's best to try Medicare supplement on the first hand side, because you quite literally might not ever be able to get that again. Okay. Next, moving on from Medicare supplements, we're going to go over Medicare Advantage plans. I have several Medicare Advantage clients. It works out for them. You just got to make sure that you input all the information, their doctors, their medicines, and then try to, match up a plan that's going to serve them the best. So Medicare Advantage, again, is unlike original Medicare. Medicare Advantage plan is funded by individual policies offered through private health insurance companies, just like MedSups are private. These are private as well. Benefits from these, they're all over the place, man. Most of them are going to have $0 premiums, but you are responsible for copays and coinsurance to an extent. Okay. With Medicare Advantage, you are tied to a network of doctors and hospitals. Something that I mentioned with Medicare supplements, you can go anywhere in the country. You don't have networks with Medicare supplements, but you do with Medicare Advantage plans. Okay. So again, there's this $0 present that's just wrapped up with a little bow on it that gives you medical coverage, dental, vision, and hearing in most cases. It gives you a max out of pocket. So it still serves the purpose, right? So I would, it still serves the purpose to get away from just A and B. It's gonna give you a ceiling, right? It's gonna take away that unlimited 20% that you might owe. It's a value-based care model. That just means that doctors and facilities, they get paid. Those facilities and doctors get paid if they make you better, right? That just means value-based care model. And there are also some transportation benefits in there as well. But we'll dive into a little bit more on a Medicare Advantage, how it's different than a MedSup. So on this side here, you got Medicare Supplement Plan, and on this side, you have Medicare Advantage Plan, okay? So a monthly premium, you will have a monthly premium with a Medicare supplement. You could have a monthly premium with a Medicare Advantage plan, but a lot of them are going to be $0. One that's very popular is through a company. It's through Aetna. It's the Value Plus. It's $23.80. It just gives you a little bit more benefit, but most of those plans on the Medicare Advantage side are going to be $0. All right. So moving on, includes Part D and dental and vision. With a MedSup, no, it does not include that. With Medicare Advantage, it says sometimes it can, and usually it does. Okay. Do you have any copays with MedSups? No, you do not. Now, outside of one, maybe two copays with a plan in on a MedSup side, no. Medicare Advantage plan, do you have copays? All the time. Out of pocket, no on MedSup because you don't have to pay for really anything outside of that deductible. Yes, for Medicare Advantage plan because you have to pay for everything, right? Restricted network of doctors and hospitals, MedSup, you do not have a restricted network. You don't have a network at all. Medicare Advantage, you do have a network that you have to stay within. Here are the rest of these. I'm not going to go over all of these except for the last one. Use any Medicare doctor / hospital nationwide. With a MedSup, you can because you don't have a network. Medicare Advantage, no, you cannot use any doctor because you have to stay within that network. Here are some important dates for Medicare Advantage. All right. The biggest one probably is going to be AEP, annual election period. This happens every year from October 15th to December the 7th. This is where everyone makes changes to their plans for the next year, right? So this is the year of 2026. If you have a Medicare Advantage plan, in this year, you would have to come and see us, or you would have to, we would have to look at your options for 2027. But you have to do that every single year with Medicare Advantage. You do not have to do that with Medicare supplements. So that's the annual election period. That's the biggest one. You get your plan for the next year, okay? And now the next one is going to be Medicare Advantage open enrollment period. That goes from January 1st to March 31st. This just means that if you made a change or you enrolled in a plan during AEP for the next January, this just means that you're allowed to make one more change. Okay. You can make one change if you elected a plan during AEP. You can make a change during this time. And then the last one is ongoing. It just says generally available only through qualifiable life events, like if you moved out of your planned service area or you lost coverage or had a change in Medicaid status. But those are going to be your big Medicare Advantage enrollment windows. All right. I'm actually not going to go over this. This is just choosing what's right for you. I mean, I guess I could touch on it, but if you come in office or you want an appointment with us, we're going to go over all of this, just basically without thinking about it. I'm just going to go through all of these things. We're going to talk about both sides because either side could work really well for an individual. You just have to see which one kind of fits that, specific individual. All right, so moving on, prescription drug coverage. All right, this is kind of rounding it out here. You got your prescription drug plan, which is your Part D. All right. So with these, it's an optional prescription drug benefit. They say optional, but if you don't get it, they'll charge you a penalty if you don't have credible coverage. You can get it one of two ways. You can either have a standalone, which means that you have A and B, you have a Medicare supplement, and you have to buy a separate drug plan, or you can get it included in your Medicare Advantage plan. But it's a federally enacted program administered by private insurance companies. Here's this here. If you delay taking Part D without credible coverage, you'll have a permanent late enrollment penalty. Part D plans are required. All the things that we've already talked about, right? Here is some cost structure here. You got a couple of phases with prescription drug plans. Typically, they will, well, not typically, but they will have a $615 drug deductible on them. But that only applies to tier 3, 4, and 5 drugs. If you have a generic, like a tier 1 or tier 2, you don't have to satisfy that deductible before you get to that. Phase 2 is going to be after you've covered your deductible. Of the $615, your max out of pocket for your drugs, if they're covered under the formulary, is $2,100 annually. And then catastrophic coverage is after $2,100. You'll pay $0 for all of those drugs that are covered. It's a big word, so they have to be covered on the formulary. Insulin was capped at $35 a month. Vaccines are free, and they have some programs. Some programs where you can get discounted meds for low-income individuals. Here are some other helpful resources. Now, obviously, we would love for you to talk to us, but you can get all this information on Medicare.gov. It's the government Medicare site. It's official. There's some books just to kind of help people along. Let's see. Here's some stuff over here that I want to talk about. So let's just say that you got A and B, you got a MedSup, you got a separate drug plan, and you get a separate dental vision, or you get a separate dental vision and hearing plan. And in your prescription drug plan, there's going to be some things that, cancer drugs are typically not on the formulary. So you might need to look into grabbing a separate cancer policy, maybe $5,000 or $10,000 cancer policy that can cover you for either 2 years or 5 years of cancer drugs. That just means that they'll give you a lump sum of either $5,000 or $10,000. And because of the illustration on the last slide of the max out of pocket of $2,100, those would kind of suffice. But there's just some other things that you can consider to talk about, and that we can talk about, while you're here in office. Just some other things. All right. That's going to bring this to a close. Hope you learned something about Medicare that maybe you didn't know, or hopefully you learned that this guy can make it really easy. Maybe I need to talk to him. And really that's why we're doing this, because we know how confusing it is. And I personally wouldn't want my grandmother to try to figure out Medicare by herself, because she could probably, pick the wrong thing, or, kind of mess herself up a little bit. So it's always good to talk to an agent that is not trying to sell you something. They're just presenting both options, and just, helping you choose the right option that's best for you. So thank y'all, man. Here's our address here. If y'all want to come and see us, we're Pontotoc Insurance Agency. There's our phone number to the office below. It's 662-200-2249. And obviously we have a website. pontotocinsuranceagency.com. But I hope you guys enjoyed this. Give us a call or come by. We would love to speak with you, and we'd love to help you guys out and in your Medicare journey. But for this, that's all we have. So I appreciate you guys. Thank you all for tuning in, and just let me know if you guys need anything.